with all these distinguished guests. And right now, our lives depend on us getting out to the polls. And when we come out and turn out, we win. As of right now, they're saying over 15 million people have already cast their votes during early voting. So if you are in a state where you can early vote, please do so. I wish you guys had all that we have here in Colorado. We have 368 drop boxes throughout our states. We have where you can pull up and drop off your ballot. So if you don't want to vote on election day, you don't have to. And we had the largest turnout because of that. During the COVID, we had a primary, and our state returned 99.3% of our ballots. And so I just want to leave you with one thing before I have the honor of introducing Congresswoman Johnson. The 3 S's: if you show up and if you stand up, you will secure your place in history by voting. And with that, it is an honor to introduce Congresswoman Johnson. I've gotten a chance to know her over these last 6 months. She has worked diligently with us, and whenever we ask her to come on the call, she does. And so I am really interested in hearing a little bit about science. And this is what she said during one of our calls. She said, voting is the only time democracy we are equal. So with that, I would like to introduce to you Congresswoman Eddie Bernice Johnson.
Let me start again. Thank you very much for that introduction, and thanks to all of you who are on this call. I really want to thank the Sisters Lead, Sisters Vote for hosting this forum, and especially President Holliday for giving me an opportunity to participate. I will say that early voting started this week in Texas, and we've had a tremendously heavy turnout, which I'm very pleased about. I am heartened to see the gathering of all these talented scientists and advocates, and I want to commend you for joining in this event and seeking out opportunities to make your voices heard and contribute your skills to improving our democracy. As chair of the Science, Space, and Technology Committee, it has been a constant, diligent struggle to make sure that women have the opportunity to just use their skills and encourage them to continue to acquire skills in this area. Because by design, our system of government relies on active engagement and vigilant oversight for citizens just like you. But sadly, public trust in government has been severely eroded over the past few decades. Today, only 20% of the Americans say they trust federal government to do the right thing. Congress has an 18% approval rating, and clearly 60% of Americans are not satisfied with the way our democracy is working. The only thing we can do about that is to make sure that everyone we can influence participate. Recent events have only fanned the flames of cynicism. Americans are facing extreme political division, growing misinformation, and historic public health crisis, severe economic strain, and anguish over the deaths of Black Americans at the hands of police. So I believe this could be a watershed moment for civic engagement. Today's challenges demonstrate the vital importance of civic engagement for building a more and just equitable society. When people do not engage with their government and work to influence the decisions that affect their lives, policies fail to address their needs, favoring instead those who have power and resources, and as a result, deepening inequality. We know if we don't get counted, we have a problem. And right now is the ending of the census for this decade. We all have the responsibility to play an active role in our community where we can and where it is encouraged, and whether we are doing anything or in elective office ourselves, we've got to encourage our family and friends to vote, volunteering for a local charity, writing a petition, or running for elective office. Civic engagement is a vital ingredient in our democracy, and we all have something valuable to contribute. We must ensure decision makers are drawing up on the best ideas and thinking through all of the implications of policy decisions. And our voices must be heard. We cannot assume that they know all of our positions nor understand them unless we make sure they're heard. The 2020 census is very important, and it seems that we've had every type of interruption we could have, including the virus, to get in the way of this important activity. This will last for 10 years, and we are in the midst of an enormously consequential election and the Supreme Court process. All of that will depend on how we elect people to make major decisions in the next 10 years. As a matter of fact, our ability to elect people will be influenced by the count in the next 10 years. For every person that is missed, more than $1,000 a month for 10 years will probably be lost for services that would be available otherwise. So, but this group of scientists and advocates in particular has a lot to offer. As the first Black woman and a person and the first woman to chair this committee, I know that the need is great. And I have tried very hard to steer us in looking at these needs. I've sponsored a number of bills aiming at advancing research to inform policymakers, including Forensic Science Research and Standards Act of 2020, promoting fair and effective policing through research, and the National Gun Violence Research Act. But this can't be a one-sided effort. We need members of the public to pay attention to what policies and programs are being put in place. We need to demand transparency in the process and push for changes that their community needs and are not being met.
In this? Okay, okay.
So even in science and medicine, we know what happens when Black and brown and female voices are not heard. We're feeling it right now with this pandemic. Medical research doesn't benefit everyone equally. Artificial intelligence systems assumed to be race or gender neutral, in fact, is highly biased. And environmental research doesn't prioritize the needs for the most vulnerable communities. We urgently need more women of color in the sciences to raise their voices on issues that matters to them. You all have worked hard to get where you are, and those life experiences and skills are invaluable inputting to the policymaking process. I need to hear from you. By speaking your mind and asking your questions, you can help to lower some of the barriers and open the door of opportunity a little wider for those who will come after you. I thank you, and I hope that you'll have a successful conference.
Thank you so much, Congresswoman Johnson. We appreciate that. And most importantly, we appreciate your service and your dedication to supporting science and helping us to shape our world. It's time for us to delve into our real discussion for today. So I'm going to turn it over to the moderator of our first pod to deal with the impacts of COVID-19. Felicia Davis, I'm turning it over to you.
I want to thank Congresswoman, Chairwoman Johnson for setting our conversation and the proper framework. So as we go forward to address two of the most critical issues confronting not only our families and communities, but indeed our nation and the world with COVID-19 and then also climate change. Knowing that we have strong leadership already in place is definitely encouraging. Um, my role with serving as moderator for the COVID-19 coronavirus pandemic, or as they would call it in my neighborhood, the Rona. Basically, the Rona is impacting every aspect of our life. Top of the list certainly is healthcare, health insurance, lack of insurance. We have what we call essential workers that enable some of us to shelter in place and quarantine, and yet some of those most essential workers don't even have paid leave. So if they're sick, they have to come to work anyway or risk falling back as they risk their health on our behalf. Small businesses are closing, larger companies are laying off workers, millions are unemployed. There's a sense of despair in the community, all sorts of growing social ills, whether family violence, violence generally, substance abuse, etc. And as our nation and the world reaches for a vaccine that we think will bring some relief, we don't know who or what to trust. And so with that said, Dr. Crowder has a wealth of experience and is among the front line of the most essential workers as an emergency room physician, and with experience that touches on just a plethora of the areas that and impacts that come forth as a result of COVID-19. So, Dr. Crowder, I think you can set the conversation, and then the rest of our panelists will join in after you kind of set the table for us. And I don't know if you have slides, but
yes, I do. And I sent them over to Holly Weeks. So Holly, if you can just pull up the first slide. Thank you very much. All right. So we're going to talk today about developing an action plan during COVID for voting. And I recommend that in listening to this presentation, you listen to it newly, like you've never heard about COVID, because you'll find that some of the things that you've actually heard about or seen on the news maybe didn't touch on the important areas or didn't emphasize the important areas. So I've been an emergency medicine physician now for 30 years. I've also done a lot of public policy. I worked on the Clinton Healthcare Reform Task Force with Dr. David Satcher. I do a free COVID webinar on Tuesdays and Thursdays at 8 o'clock. And I have the research, the materials for this, as well as the invite for the webinars are on askdrv.us. So if you want to see any of the source documents or you want to come on the webinar, just go to that website. All right, go on to the next slide. Let's get started. All right, so the intention is to provide scientific clarity to the COVID-19 information to help you and your family develop a plan to vote as safely as possible during the COVID-19 pandemic. The outcome, go ahead and click next. The outcome you will leave this webinar motivated to create an action plan for yourself and your family, or you may be motivated to create an action plan for a broader community. You may be working with a church or a union or a homeowners association or a school. Go ahead, next. So what is a pandemic? A pandemic is basically the worldwide spread of a new disease, and the new disease must be infectious and contagious, and is something that people do not have immunity to. So a pandemic is not something like heart disease or cancer. Examples are smallpox, polio, tuberculosis, HIV, bird flu, SARS, and MERS. So we've actually experienced a lot of different pandemics. Next slide. So why is it called COVID-19? And I'm sorry, the slides were not black. The lettering was not black until I sent them over to Holly. So when we did the change of who was going to do the screen share, some of the coloring actually changed. But why is it called COVID-19? Go ahead and hit the next slide. All right, CO stands for corona, which is Latin for crown or halo. If you look at the virus on a microscope, it looks like to the right, and it has a crown or a halo around it. Next, VI is for virus. Next, D is for disease. So that's how you get COVID. Next, 19 is 2019, which is the year that the strain appeared. There were not 18 versions ahead of time. It was just the year that the strain occurred. And click again. And that is how we get the name COVID-19. In the sciences, we call it coronavirus SARS-2. All right, go ahead. All right, so how does this spread? Primarily people and surfaces, okay? So people through droplets or airborne, nose and mouth, and surfaces, it lands on various surfaces, right? So, but the primary is people to people, but you can also get COVID through surfaces. Next slide. So it's droplet and airborne. It stays on surfaces for long periods of time, cardboard surfaces for 24 hours, plastic or metal surfaces that are less porous for 96 hours. Next slide. It's highly, highly contagious. Minimum time of exposure to coronavirus is 45 seconds to become infected. 45 seconds. The other way we measure contagiousness is how many people out of 100 actually get infected if they actually get exposed to it. For COVID-19, it's 60 to 80%. So 60 to 80 out of 100 get exposed to it, will actually get infected with it. Next slide. So I talked about it being droplet and airborne. So droplets are larger, airborne are smaller particles that are less than 5 microns. So that's how come the original recommendation was that we stay 3 feet apart, and now it's 6 feet. So go ahead, that's fine. Go ahead, that's fine, Holly. So if you look, the red shows droplets and the gray shows airborne, right? So Ebola is droplet, measles is airborne. So if you could imagine the person coughs and everything in the pathway, whether or not it be people, things, countertops, handles, whatever it may happen to be, have COVID-19 droplets on them. Next slide. So there's basically 6 clusters of symptoms, and these symptoms really predict the severity of the cases. Go ahead, next slide. I don't think that COVID-19 should really be called a respiratory disease because it's much, much more than that. But cluster 1 is flu-like symptoms with no fever. Cluster 2 is flu-like symptoms with a fever. Cluster 3 is nausea, vomiting, and diarrhea. COVID-19 can present like a stomach flu, or you ate something bad that wasn't, that just gave you sort of a food poisoning. Clusters 4, 5, and 6 are the ones that are more likely to be hospitalized, wind up in the ICU, or die. Cluster 4 is severe flu-like symptoms with fatigue. Cluster 5 is flu-like symptoms with confusion. And then cluster 6 is when you have a little bit of everything. You've got the respiratory symptoms, abdominal symptoms, confusion, fatigue, etc. Go ahead. Asymptomatic people do spread the disease, and significantly. So asymptomatic spread is a very important component of this disease. So people do not have to have a fever, and they do not have to have any symptoms. Next slide. Now, there's a lot of talk about COVID-19 deaths. What I want to talk about is those that live. There's what we call post-intensive care syndrome. This is going to be very important for our healthcare system moving forward. 75% of people coming out of the ICU with COVID-19 have what we call post-intensive care syndrome. That is a permanent cognitive, mental, or physical impairment. And usually it is renal failure requiring dialysis, limb amputations, strokes, which are occurring in the young and the old. 50% of the young people with strokes actually are not able to return to work. Pulmonary fibrosis and decreased lung capacity. About 1/3 of the people after viral pneumonia report difficulty walking a block or house cleaning or getting back to their normal activities months and years after COVID-19. We've had some couple of young cases where they've actually required a double lung transplant. Next slide. All right, so I want to talk, go ahead and click it all the way through. Yep, sorry. There's been a lot of talk about kids and, you know, are kids okay? And I want to actually, there is science on this. So, and it's often not talked about. So I wanted to actually really bring up children. This is the largest pediatric COVID study that has been done. It's a multi-center study that was done in Europe with 582 confirmed pediatric COVID patients that range from 3 days to 18 years old. Go ahead. Here are some of the results. So we looked at symptoms. 65% of the people had, 65% of the kids had a fever, 35% of them did not. 54% of them had upper respiratory-like illnesses. 22% of them just had nausea, vomiting, and diarrhea. 28% only had a headache. So think about how often a young child says he has a headache. 25% did have wheezing and coughing and respiratory symptoms. Next slide. Wanted to just talk about this for just a second. These are COVID toes. This is a symptom that younger people get. I have seen it in someone as old as 54, but it's basically like a vasculitis, and their toes look like they're a little bit swollen, and they look like maybe they're frostbitten. If a parent describes this over the phone, we don't even tell them to bring the child in. We know your child has COVID-19. Next slide. So let's talk about the pediatric outcomes. 62% of the children, so almost 2/3 of the children with COVID-19 had to be hospitalized. 8% had to go into the ICU, and 4% had to go on a ventilator. 3% required medications to elevate or raise their blood pressure because their blood pressure was so low, and about 0.7% died. Now, we will not have these types of outcomes that are this good. You have to remember that in Europe, everyone has health insurance. And the other thing is that Europe does not have a childhood obesity problem, and I'll talk about that a little bit later. Go ahead. Go ahead. We're going to talk a little bit just quickly, prevention measures. I know we've all been talking about washing your hands. I just wanted to go over the steps of washing your hands, because normally we do number 1 and number 8. But washing your hands actually includes in between your fingers, back of your hands, base of your thumbs, back of your fingers, fingernails, and wrists, as well as drying your hands. Next slide. All right, this is the power of social distancing. The way we were living our life before March, one person with COVID-19 would infect 406 people in 30 days. With 50% and 70%, 75% less exposure, that one person can go down to 2.5 people infected. Next slide. Transmission. I want to talk about wearing a mask. The person to the left actually is a COVID-19 carrier and doesn't know it, and the person to the right is healthy. So if the healthy person wears a mask, the rate of transmission is 70%. If the COVID-19 person wears a mask, the rate of transmission is 5%. If both people wear a mask, the transmission probability goes down to 1.5%. So that means mask wearing is 98.5% effective. We will probably not have a vaccine that is that effective. Next slide. So I want to just talk quickly about risk factors. Go ahead. Because there's some risk factors that people have not heard of. So I know they've heard of folks, you know, in a nursing home, were born before 1955, chronic lung disease, immunocompromised, etc. But let's talk about a couple of other things. Obesity is a risk factor at any age. So a young person who is obese is at a risk, as a risk factor, almost like an elderly person who's not obese. Next slide. Obesity is defined as a BMI greater than 40. This is the height and weight criteria for a BMI greater than 40. And this is basically because obesity is associated with inflammation in the body, and COVID-19 causes a very strong inflammatory response in the body. Go ahead, next slide. Other risk factors. People with blood types A and AB are more vulnerable to COVID-19 and more likely to require ventilation and critical care treatment. Those with type O have significantly lower risk for the infection and also do not seem to get as sick. Smoking and vaping. 40% of the hospitalized patients between 20 and 54 years old have a history of smoking and vaping. I recommend that people quit smoking or vaping immediately during this pandemic. Next slide. Men are also at higher risk for getting the disease, and they're at higher risk for doing poorly if they get it. Men are 58% likely to get it, women 42%, but men are almost 40% more likely to die from the disease than women based upon research from China. Go ahead. Let's talk about what to do. Go ahead, click it on through. This is a pulse ox. I'm going to actually talk just quickly about what to do if you did find out you were COVID-19 positive, or how to set up a quarantine room. You want to buy a pulse ox from Amazon, which is pictured over there to the right. It's about $30. I recommend everybody in the sound of my voice take zinc and vitamin D3 every single day. It's been shown to be protective. So you take that, you can take zinc and vitamin D3 whether or not you're COVID positive or not. And also, if you are COVID positive and you're in quarantine, you want to access a bathroom that is only to be used by you. You want to make sure to have access to your cell phone, and you're not calling other family members because you would infect them. You're going to call 911. And then you have people leave food at a closed door. You open windows, and if you're in a family and at home where you're with other folks, you want to make sure to use a HEPA filter in your HVAC system. Go ahead. Let's talk about planning your vote, and then we'll be done. All right, go ahead. Number one thing to do to plan your vote. Go ahead, click it through. Get a flu shot. Get a flu shot now. Now, a flu shot, when you get it, it takes 2 weeks to actually work. So if you get a flu shot now, it may work by election day. But the issue is that people in the wintertime will be getting COVID and the flu. Both are respiratory tract infections, and that increases the morbidity and the mortality of the disease. Go ahead. Number two thing to do now. Buy an N95, KN95, which is just the Chinese version of the N95, or an N99 mask. Click on through so I can show some pictures of these. This is basically what they look like. You can get them at a lot of different stores, including Amazon, eBay, etc. Go ahead. You'd want the ones that do not have a valve. The one that has a valve to the left is used for construction use, and that actually allows you to blow out. And so if you're COVID-19 positive and you don't know it, you could be infecting others. So you want the one with no valve. Next slide. Please do not use these. The neck gaiters, they've been shown to actually increase the risk of transmission of COVID-19. Next slide. Number three thing to do now. Bring your own chair, water, snacks, hand sanitizers, and wipes to the polls. So a couple of things. One is I often, if I work on election day, have people pass out on election day. So I think in general, it's very good to just have a chair and water and snacks in general. I recommend hand sanitizers and wipes. The main thing that's not on here is gloves. People often will infect themselves with gloves because they don't know how to properly handle their hands with gloves on. So it's better actually just use hand sanitizer and clean your hands frequently. Next slide. All right, the best strategies for voting. Pat talked about dropping in a drop box. That is the best if your state has it. Better, next is absentee ballot. Early voting is good. If you feel like you're at a risk factor, you want to make sure and you really want to get out there and go to the polls, I would say try to go first thing in the morning, as soon as the polls open, because those machines have not been touched by as many people. Always wear an N95 or KN95 mask if you can. The difference is, and I just want to just say this, an N95 mask blocks out 95% of the particulate matter. That's what the 95 number is for. The masks that you have that are sort of like the, I don't know, like dentist mask or the homemade mask, those are 40% effective. So it's a difference between 40 and 50% effective and 95% effectiveness. Go ahead. I want to thank everyone for shutting down. I know it was a great sacrifice that we all made, but the studies have shown that we prevented 60 million coronavirus cases in the United States. This is millions of lives that we saved by actually shutting down. And so I want to thank everyone for actually doing that and the sacrifice that, that you made for the country. Next slide. Right, these are just some places to stay alert and stay informed. covidactnow.org. Actually, you can look up what is the infection rate in my county. What is the, how many contract tracers do they have? World Health Organization, and then I've also put again my website. And that's all. And as I say, respect COVID-19. Thank you very much.
Thank you, Dr. Crowder. That was, I wasn't sure where it was going to go, and it was very comprehensive. I think next we're going to bring up Adrienne Gladden Young, who's a researcher. And Adrian, I'm thinking there's a couple of ways for you to go with this, but yeah, let me just turn it over to you.
Okay, I can receive some instructions or direction if you have them.
Yeah, I am curious for you. I thought that you would speak as a researcher and not necessarily, I understand that you don't work specifically on COVID vaccines, but just your perspective as a researcher.
Yeah, well, I appreciate all of the information that Dr. Crowder, Dr. V shared. And what's striking to me is how little how much or how little of this information is actually available to the public. That's what's been missing the most, I think, over these past, 10 months. I think that there's a lack of public or efforts to educate the public adequately. And that has led to, more than 200,000 deaths in America. And, there's been this, I feel like there are a number of issues that I want to see addressed. I'm not a policy expert, but as a scientist, I do rely on data. And what I've seen is been disturbing. And I've seen, who has not, the people in charge who have not listened to science. And more than that, they've gone out of their way to actually undermine, sound scientific advice. I've seen, public disregard for these suggested preventative measures and just basic data for research. I know that there's a lack of funding, or at least adequate funding for the necessary research to make things like vaccines safe for everyone. I think about the vaccine candidates that are in clinical phase 3 clinical trials now, and I think while the science behind the vaccine design seems pretty sound to me, I think that overall the effort has been very rushed, and just the baseline research hasn't been done to ensure that this testing and these vaccine candidates can be safe for everyone. So I would want to make sure, I would want people to pay attention to getting more information about COVID-19 and how the risk factors. Yes, I think we should pay attention to the risk factors, some that Dr. V outlined, like obesity, but there are certain populations that have been disproportionately impacted during this pandemic, and we still don't know, we still don't have all the information to determine why. And that's important, because things like, there are certain factors that make people more susceptible to infection and more susceptible to disease progression, or ended up in the hospital. And we actually don't have enough data to determine that. And some of those factors will also determine the way that people respond to vaccines, for example. And so it concerns me when I think about, vaccine candidates being tested in tens of thousands of people, and we still don't know why, certain people are at, higher risk for becoming sicker. And then just overall, like I said before, there's a lack of funding. Public health departments, they haven't, they're not funded adequately. And so it's impossible to conduct research and surveillance, testing, and other prevention and treatment efforts, which is extremely important, for people to think about, and to, ensure that, our local and state, especially our, state public health departments are funded so that they can actually take care of, the communities, our communities.
Thank you. That's drawing the circle out a little wider. I'm going to skip now to Abigail Echohawk, because certainly we are well aware of disproportionate impacts on certain communities, whether it be underlying vulnerabilities or the nature of the work and culture of communities. But with all of those issues, certainly indigenous communities have been hard hit, and we certainly have to respond in kind. So what are some of the issues that you feel come up within that broader context of communities that become the poster child for all things bad?
Thank you so much for that question. It's a really important one, particularly as we're talking about the vulnerabilities and risk factors that exist, particularly for communities of color in this country. And so I am Abigail Echohawk, and I'm a citizen of the Pawnee Nation of Oklahoma, which is a tribe that was relocated to the Oklahoma territories. We are originally from Nebraska and Kansas, but we are the first peoples of this land. And we know nationwide for indigenous peoples, we have been hit really hard with COVID-19. But people often talk about our vulnerabilities and our risk factors, and just like you just said, make us the poster child for all things bad, when in fact the risk factors are not because I am a Native person. The risk factors are because I'm a Native person living in a country built on colonialism and the genocide of my people. For African Americans, built on the enslavement of people, Hispanic, Latinos, immigrant and refugees. Our vulnerabilities and risk factors are not an individual or community, our community's responsibilities. It's this country's responsibility. And so we want to look at our risk factors in that way and recognize that as a result of this systematic oppression, we are seeing what I believe the system that was built actually working. So in directing the only national, I direct the only national tribal epidemiology center in the country, and I'm serving and representing the needs of urban dwelling American Indians and Alaska Natives, so tribal people living off reservation lands in large urban metropolitan areas. We're on the bus next to you, we work next to you, our kids go to school with you, and that's most of our population. And what we have found is that regardless of where we live, whether we're on the reservation or if we're in the cities, COVID is hitting us hard. I was recently a co-author on a paper in the CDC's MMWR, where we found that American Indians and Alaska Natives were 3.5 times more likely to be infected with COVID-19. And we're working on another paper related to the mortality, where we see very similar things happening across our community. And I think what is really important when we talk about this conversation of how is the science driving us forward, and why is it so important for policymakers who we elect and are elected to follow that science? And for my community, access to the science is limited. Access to the resources are limited. So for example, I have been in a fight for data around American Indians, Alaska Native, and COVID-19. We're relying on that data for allocation of resources. We're relying on that data to understand what's happening in the community so we can direct intervention. However, as a direct result of what folks like myself have been doing for years and saying for years, that our people are racially misclassified or they simply aren't collecting race and ethnicity, we are unable to truly understand what is happening in our communities. And what we do know is horrific, but we know that to be a gross underreport. And I think it's an example of that is that the CDC very often isn't requiring the reporting of race and ethnicity. And their new plan that they just put out for the collection of demographic data related to who gets a vaccine when we have one, in the optional variables of what clinics and states report back to the CDC, it is optional for them to report back race and ethnicity. Why is that? Because if they report back race and ethnicity, you are able to see the stark disparities that exist in communities of color. By not reporting race and ethnicity, they have created and are maintaining a system that is built on structural racism that marginalizes people of color by effectively hiding the impacts of disease, pandemics, and other things like is happening with COVID-19. So folks like myself, we are fighting every single day. And the most movement that we've seen in my community to get access to the data that we need came from a letter, for a bipartisan letter from 26 members of Congress that demanded the CDC answer our call and tell us why they weren't getting us access to the data that we needed to intervene and to really work and ensure that our people were not so disproportionately hit on both the reservation areas and also in the urban settings. Without those members of Congress and that political power that is held with policymakers within states, within counties, we're not able to get what we need. And particularly for Native people, we don't hold the same political power that other communities have. We often have to rely on allies, or what I call accomplices with us, to help push for that systematic change. So just know that's why it's so important for people to get out to vote for people who are going to back the science, and to recognize that we also need the people who are going to fight to ensure that all people have access to the science, and that the science isn't effectively eliminating us, which is what is happening to Native people in the data. I feel like I've never worked more in my life than I have since February, and my people absolutely deserve it. Recently, I'll end with this, over the course of this time, like many Native people, I've experienced deaths in my community, and I had the 6th person that I know personally pass away 2 weeks ago. And the first thing I thought, and I almost, it devastated me, this is the first thing I thought is he actually going to be in the data? Or is what's going to happen to him is what has happened to most Native people in this crisis. We're born Native, but we die white because that's what they misclassify us on the death certificates. So we are in the fight for our people's lives, getting out the vote. And right now, Native people, we are actually could swing certain states that are battlegrounds, such as Arizona and Nevada. And if we get out the vote, we have an opportunity to ensure that science is leading, and folks who are running for office are ensuring not only they're leading and ensuring that science is represented, but they also acknowledge where there's gaps, and that they're willing to address resources and political power towards that. It's a fight for our people's lives right now.
Thank you so much for that. So far I've logged information, data, resources, vaccines, access to science, and I'm going to go next to Dr. Michaela Martinez. And I'm thinking from an environmental health perspective, we can kind of close the loop before we go to Chris Erisman for a statewide perspective. So, Michaela, what do you want to bring to this conversation and lift up? And we're keeping in mind things that we want to bring to candidates that might be seeking our votes.
Thank you very much. And I just want to say thank you, Abigail, for that. Hearing your voice and for you to be able to so eloquently and strongly talk about these issues is incredibly important and very inspiring to me. And just to build upon what Abigail had to say, and then just add on a couple points that I 100% fully agree that what we're seeing today with the disparities, particularly Black, Brown, and Indigenous people being hit so hard by COVID-19 is a direct consequence of the system of racism that has been built to actively oppress and cause violence against people of color. And so one of the things that I've found, and during this pandemic, particularly working with Black and Latino communities in New York City, where I live, predominantly looking at the Bronx, Northern Manhattan, and Queens, is that it seems pretty clear that many of these things that we're hearing in terms of pre-existing conditions, such as obesity, heart disease, asthma, many of these chronic diseases are a direct consequence of environmental racism. We may, sit here and talk about how obesity can increase your chances of severe COVID if you're infected. Well, in the South Bronx, which is one of the most marginalized communities and predominantly community of color, there are 25 bodegas for every single grocery store. And so we have these disparities in terms of we have segregation and the environmental conditions that structures people's health. And it's that direct environmental racism which has set up communities of color to be at such great risk. Now, some of the other work that we've been focusing on is how structural racism within healthcare is playing a role in COVID. If individuals have mistrust, and rightfully so mistrust, of the medical system that has been abusive to people of color for as long as this country has been around, then people may be hesitant to seek care and get early interventions for treatment when they end up in the hospital. For COVID-19, some of the steroids that are used and pharmaceuticals are only working if you're hospitalized early on in the pathology. So the relationship with care seeking is really important. And just to build a little bit on in terms of the vaccine, it is very much part of the public discussion where I live in Harlem, that no one trusts the vaccine that we don't even have yet. And, as a person who's worked on vaccines for over a decade, I understand where this is coming from. And I see that it is a very large failing of our public health system. And I think that one of the things, if I were to talk to elected officials, I would ask, what are the laws and safety nets that are going to be in place to guarantee equal protection of people of color, especially as we are rolling out, we will be rolling out very shortly, vaccines where we've compressed what typically takes 10 to 20 years to make a new vaccine into a year or 2 years, depending on when it comes out. And when we know that infectious diseases have wiped out 90% of indigenous people in the Americas. We know that the Tuskegee trials were going on into the 1970s. And so how is it that we will have ensured legislated protection for people of color, marginalized people? And so that's...
Last but not least, first, let me just mention two questions that are in the Q&A. I don't know if everyone sees them, but what would a U.S. response to COVID-19 look like if it were based on science and not used as a political wedge? So I think that's a good intro for Chris Erisman as you bring forward a kind of a statewide perspective in terms of responding comprehensively to what is a huge challenge.
Well, thank you for inviting me. And I guess I would say that it's important to keep in mind that some of us in public health are career scientists who have served under multiple administrations. And in particular in Minnesota at our state health department, my role, I'm the highest level civil servant, if you will, in our system. So I'm a career scientist, and our team has been working incredibly hard to avoid getting caught in the political fray. But I can tell you that we certainly have felt that over the last 9 months. The question that I was kind of asked to talk about was just what questions would be important to ask related to vaccination. And I realize we heard about that a little bit, but I'd like to give you some additional perspective. My background before I became the director for infectious disease, I oversaw the state immunization program. I was a member of the advisory committee on immunization practices, the federal advisory body that makes vaccine decisions, and I'm currently a member of the National Vaccine Advisory Committee. So it's a topic that is near and dear to my heart. And vaccine remains on the horizon as the hopeful end game for COVID-19. And when I think about questions for elected officials or what kinds of things I want to see, there are two factors that drive my perspective. One is that this whole COVID vaccination will be an incredibly complex process. And I think you've heard about this from other speakers. But we have multiple vaccines in various stages of phase 3 clinical trials. That means we're going to have different vaccines coming on at different times with a variable volume of vaccine available. There's a great deal of variability in the products that will be approved for use, and we don't know which populations that they will be more appropriate for. They'll have different storage and, well, we know they have different storage and handling criteria. We know that there will likely be a need for 2 doses, but the different formulations have different intervals for those doses. There won't be interchangeability, so if you get a particular type of vaccine as your first dose, you would have to get that same type for your second dose. So there's a lot of things that are variable right now, and it's a really it's going to be a very complex process. And I think that as was alluded to, unfortunately, the title of the project, I guess, is Operation Warp Speed, is one that those of us at the state level have sort of rued. I mean, I said when we were talking to CDC about our planning efforts, you know, can we rename this Operation Safe Speed? Because even though I think the intent was to suggest we want to be as efficient as possible and eliminate as many unnecessary delays as possible, that name really gives the absolute wrong impression that we're willing to hurry up to get a vaccine at the expense of safety. And I want to express that, at least as a leader in the Minnesota Health Department, that we are unwilling to do that. That is risk safety for expediency. But I think the challenge that we face is we live in a world of vaccine hesitancy. And for those of us who work regularly on vaccine issues, it's our new constant reality. We have parents that question routinely recommended childhood vaccines. And in this type of an environment, we have to be especially careful of how we handle a new COVID vaccine. Our actions in promoting and distributing this vaccine could have a lasting effect on hesitancy going forward if it's not handled correctly. And as was alluded to by earlier speakers, we know that in order to be successful with a vaccination effort, we need to vaccinate a large proportion of the population. And we need to make sure we're vaccinating those members of our population who've experienced some of the greatest risks or severe consequences from COVID. And those are our populations of color. And yet, as you heard, these populations have had historic trauma as it relates to medical treatments and interventions. And so they're coming from a legitimate place of vaccine hesitancy. And so when we think about moving forward with a new vaccine, we have to keep that in mind. And I think we have to make sure that our elected officials are aware of those concerns and aware of the importance of a focus on vaccine safety. Early surveys suggest that only 50% of the public would be open to being vaccinated for COVID initially. And as I said, I think that has to do with the fear and concern that we're really rushing to get a vaccine. And rather than reducing roadblocks, we're shortchanging safety. And I would like to mention a couple of things just to explain a bit of what has been done to help limit roadblocks and make vaccine available more quickly that is legitimate and helpful. And that is that typically with a new vaccine, manufacturing doesn't start until the vaccine is well along in the process and has been licensed. And so there's generally a delay between licensure and availability. But with the COVID vaccine, the federal government has invested in early manufacturing so that there may be some vaccines that are currently being prepared that may not make the cut, and they're willing to take that risk and have invested money to develop that vaccine early, just so that if it does pass all the safety criteria, that it could be ready to go in a efficient manner. So I think that is one thing to keep in mind, that is one of the ways that they are looking to make sure that vaccine is available in a more expeditious manner than we would normally see. But that does not necessarily mean in that case that safety is being compromised, just simply that they're getting ready with vaccine before the safety decisions have been made. They're willing to trash vaccine in order to be prepared. So as I said, we've got this issue of hesitancy. And if we don't think about this and don't focus on safety and commit to a safe vaccine, then we're not going to have the necessary confidence in the public to have the vaccine uptake that we need to control the pandemic successfully. And so if I was making suggestions of what we want to see in candidates or what we want to see in platforms, as you heard from the other speakers, I mean, a commitment to science is incredibly important. And we want to make sure that our elected officials are committed to safe vaccine. This isn't about rushing to get a vaccine. We want to make sure that the vaccines that are selected are done so in a manner that is safe and thoughtful. So for instance, in Minnesota, weeks ago, we put on our website that, we've been working on COVID-19 planning for several months, and we're continuing to work toward the objective of delivering a safe and effective vaccine in Minnesota. We emphasize vaccine safety because while we're committed to ensuring equitable access to a vaccine once the distribution process is in place, we will only do so if we have confidence the vaccine is safe. We will take our lead from the Advisory Committee on Immunization Practices, a national independent committee who will only recommend a vaccine that has met safety criteria and fully intend to move forward with vaccinations once we know it's safe. The federal government has a robust safety process for vaccination in place, and we need to make sure that that process is fully followed. We don't want any of the processes to be shortchanged in an effort to rush vaccination. So it was very encouraging to have the FDA come out earlier this month saying that they expect and want to see 2 months post-vaccination data on potential adverse events before they would consider a vaccine, which was in direct conflict with what the White House was pushing for. So I think it's really important that we continue to ask for and demand the level of assurance and quality that we do for every vaccine that has come on the market. So I guess in closing, if I was to suggest what you want to look for in terms of elected officials, at the federal level, I'd want to ensure that they support existing safety protocols, and they want to make sure that those processes are followed. So through the FDA and the ACIP. At the state level, I'd want to know that the official supported the state health agency in prioritizing safety in making a vaccine available, setting standards for what criteria must be met before a vaccine is offered. And at the local level, I'd want to ensure that the official would support your local public health agency in their efforts to safely provide vaccine to your community. So thank you.
Thank you. And just before we close this out, two questions that came up very early on, and you somewhat addressed what criteria needs to be met before women decide to receive a vaccine, a COVID vaccine. And then this is a good question. Will a vaccine developed for COVID-19 have to be adjusted for a potential COVID-20 or 21, like the flu, the influenza has to be shifted? That's one coming in from Renee Redwood, a board member for the National Coalition and a member of Black Women's Roundtable. So you might.
Who are you directing that to, Felicia?
Yeah, would you like us to answer or to type or?
Yeah, I'd like an answer. I thought it was a good follow-on to the Chris Erzman's comments.
Sure, this is Chris, and I'll just make a couple comments, and I'm sure others may want to say something, but I think that you would want to make sure that the clinical trials, and this is something that we will obviously be looking at collectively in public health, but for you as a Black woman, you want to look at the clinical trials that have been done and ensure that the populations that were included are diverse and include representation from Black women. So in other words, I know that the manufacturers are working hard, the pharmaceutical companies are working hard to make sure that the populations that are engaged in the clinical trials are diverse, but you want to ensure that that's happening so that we have data about you and your community. And then the question about will this be an annual vaccine, that's something that remains to be seen. It is likely that COVID vaccination may be necessary, on an annual basis like we see with influenza, but there are still so many unknowns. It's too early to say that definitively. So we're going to continue to learn a lot as we move forward. But I would want to say that in terms of when you feel comfortable getting a vaccine, you want to know and you want the data to show that the vaccine has been tested to be safe and effective within your community. And as a public health leader, our commitment is to evaluating that as well. So we'll have that data to provide.
And my co-moderator is Kathy Manduka, who's standing back a bit. But Kathy, is there something burning to bring up? Or if not, I think I'm going to hold the wrap so that we're making up a little bit of time. But Kathy?
No, you can go for a wrap. I've totally appreciated all of the speakers talking in practical terms about what to be looking for in policy and what to be asking our candidates.
Yes, and because
Felicia, can I add something just real quickly about the speed of the vaccine? I think it's really important. I know people are really concerned that because this is happening so quickly that this might not be trusted. And I just want to say there was a lot of research done on the SARS vaccine, and SARS and COVID-19 are very similar. So a lot of the baseline research that needed to be done for this particular pandemic had been done under SARS. So that is part of the reason why we didn't really have to start back with the basic science and the animal research, because the viruses are so similar.
Thank you. And is there anything anyone else would like to interject before we pass it over to the next panel?
Yes, this is Michaela Martinez. I just wanted to interject and make just one comment following up on the last couple of speakers. I've worked on the infant immunization schedule and childhood vaccines and eradication programs now for about 10 years. And, even though I'm a fairly junior scientist, I really strongly feel that, and I tell my colleagues, we have to have some real humility when it comes to talking about vaccine safety. The last time that we very rapidly rolled out a massive vaccine quickly was the IPV vaccine back in the 1950s. And even though we had done the biggest clinical trials for safety and efficacy that this country has ever done, we still ended up having a manufacturing, like horrific accident that resulted in giving 200,000 children polio and paralyzing a couple of hundred. So we know that things can get messed up and go horribly wrong when when there's so much public pressure and such a need to develop a vaccine, get it out quickly and such. And so, when it comes to things like measles vaccine, varicella and such, we have trusted vaccines that we've used for many decades. But I do think that given that we're using new platforms, given that there's so much public pressure, that we shouldn't just always be putting our trust in the system working, because we have a history of it failing.
And I just want to make one comment. This is Abigail Echo-Hawk, and I suggest that folks, particularly in the Black community, that you follow the work of Dr. Reed Tuckson, who is a physician and an incredible advocate who was initially starting to work out of the DC area with the African American community, particularly around ensuring a proper recruitment of African Americans into the COVID-19 vaccine trials. But they've taken that work nationwide, and it is a collaborative of African American doctors and researchers who are working to provide the education, ensure that there is informed consent, and that we are making sure that anybody who enrolls in those trials, because we do need diverse representation, but we want to make sure they're not coerced, and we want to make sure that they're given all the correct information. And so, using the example of Dr. Tuckson and others, I'm leading that same work within the Native American community. But so follow the work of Dr. Reed Tuckson. It's very easy to Google him, and you'll be able to then connect to what's happening in the African American community to ensure safety of the vaccine and proper recruitment into the clinical trials.
Thank you so much. And with that, Holly, I'm going to toss it back to you to come on, and I'm hoping our COVID panel will hang around for our climate conversation.
Thank you, thank you, thank you, Felicia. Masterful job, great information. And now you see why we do indeed know that science will be on the ballot and is already on the ballot. I want to just move right into our second pod on climate change and introduce our moderator, Catherine Maduka. Catherine, please take it away.
Thank you, Holly, and thank you to the first panel, and thanks in advance to the second panel. This panel is going to focus on the role of science in our response to climate change. Climate change is an issue that's global. The Earth has one climate system. All of us contribute to the changes in that same global system. However, we feel the results of climate change locally. The impacts in Minnesota aren't the same as the impacts in Louisiana or California. And those impacts are really big, right? Their climate change impacts our food supply, our health, our economy, and our safety. Like our response to the COVID-19 pandemic, this is an issue where the response at all scales, individual, local, state, and national, makes a difference in how we are able to lessen the long-term impact, to manage the challenges we face today, and to prepare for the challenges to come. So our panel today is going to help us see through their eyes into the issues related to climate change and to think about what we might want to ask our candidates and how we might evaluate their responses. And we're going to start with Dr. Marilyn Raphael, who's going to introduce, she's a climatologist and a professor at the Department of Geography at UCLA. Her work focuses on developing computer simulations of climate change that help us to understand what our climate, our oceans, and our atmosphere may look like in the future. So through those eyes, she's going to give us an introduction to the issues around climate change. Marilyn, go for it.
Thank you. Good evening, everyone, and thanks for the opportunity to talk. Holly has my slides, so could you put them up?
We have them queued up and ready to go.
Thank you. That's just the introductory slide. Could you go ahead and advance it, please? So we've known for some time now that the average global surface temperatures are increasing. We've felt it ourselves. That increase is confirmed, or it's supported by the observations that we've been making from since the 1800s. So the slide on your left, image on your left, shows you that change in temperature. The values in red show you that from about the late 1970s, we've had more or less steady increase in temperature. We also know from observations that the carbon dioxide content of the atmosphere is increasing. The figure on the right shows this increase beginning from about 1960. These are measurements made at Mauna Loa Observatory in Hawaii, where we have some of the cleanest air. The science is clear. The trend of increasing temperatures at the Earth's surface is directly linked to the trend of increased atmospheric carbon dioxide and other greenhouse gases. Next slide, please. So what does that trend look like distributed around the surface of the Earth? You've already seen the image on the left, but on the right, that's the surface distribution, surface temperature change. One of the things you notice right away is it's red all over the map, but there's a variation in how much change in temperature we've been experiencing across the globe. So if you look just at the US right there, or North America, you'll see that the southeastern part of the US is a little bit cooler. The North Atlantic actually is cooler, and some regions around Antarctica are cooler. Next slide, please. Focusing on the US, including Alaska and Hawaii, our annual temperature has been increasing, and in some places, the increase is as much as 1.5 degrees Fahrenheit. And you can see a lot of that is weighted towards the middle and western part of the US. This change in temperature is occurring in winter. It's more dramatic in winter, and it's also occurring in summer. And I want you to remember that in the US, temperatures are increasing everywhere, but not everywhere, sorry. The southeastern part of the US, temperatures are decreasing a little. Next, what's the consequence of this change in temperature? What's the result of the increased warmth? Well, I thought I'd put a couple slides in that shows something potentially good. We have a longer growing season. That's the slide, or the graph on the left. Time is on the x-axis, and the deviation is on the y. And what you can see, if you follow the orange line, is that the length of the growing season, once we reach around 1980, has started to become positive. So that we have a longer growing season, and right now, or back where that chart shows, we have our growing season is about 2 weeks longer than average. 2 weeks is a long time if you're a farmer. Well, it's a long time if you're anybody. Then on the right, you have a change in timing of the blooming. So what you see is some regions are seeing blooms. Trees are budding, flowers are blooming earlier, and some are seeing blooms later. The regions where blooms are occurring later is where on the earlier map you saw it's cooling. And then the regions where we have blooming earlier is where it's warming. Next slide, please. I put this one in because this is an event. The cherry blossom event in Washington, DC, people plan their trips around them. So what you find now is that the peak of the event is occurring earlier. What that means is that the blossoms are blooming earlier, so they're peaking earlier. And there's a difference on the order of 5 days if you compare what was happening between 1931 and 1960 to what is happening now. So flowers are blooming earlier. Next slide, please. Moving away from growing things, a direct result of the warmer temperatures is increased melting of land ice and sea level rise. What the map shows you is what's happening at the world's oceans. And in general, that blue color that dominates everything indicates that sea level is rising. If you look more closely along the coast, we have, those little dots indicate regions where there have actual measurements. Look at the US. You'll see that along the east coast of the US and along the Gulf Coast, the sea level is rising. And also along the California coast. To the right, that just gives you a sort of integrated idea of what's happening, and the rate of change, the rate of sea level rise is 3.3 millimeters. Now, a millimeter is really, really small, but if you take that millimeter and you spread it out over the ocean, that's a lot of water. Next slide, please. Accompanying the increased warmth are changes in the atmospheric circulation. And these changes give rise to extremes of temperature that are climate change related. The point here is that when we think of climate change, we just think of increasing temperatures. But really, what we have is an ever increasing occurrence of extremes. Next slide, please. And the first one associated with temperature is heat waves. The frequency of heat waves has increased. In fact, if you look at the length of the heat wave season has also increased. And the map shows you, the maps shows you the frequencies and the heat wave, the length of heat wave season for 50 major cities in the US. Now, the heat wave season is 47 days longer than it was in the 1960s. And if you look at the frequency map, the orange ones, not the orange bars, you can see that in the 1980s, we had something on the order, 1960s, we had on the order of 2 heat waves a year. And in 2010s, we have on the order of 6 heat waves a year. So a pretty dramatic increase. Next slide, please. We have increased frequency of droughts associated with climate change. And this map just shows you at the county level, the distribution of droughts and their change in frequency. The first thing you realize right away is that not all of the US is subject to these extreme droughts. A lot of it is focused in the west and the southwestern part of the US. In fact, the counties in the red and dark red have had at least 200 weeks of droughts, or 200 weeks of conditions that were extreme or exceptionally dry. This is 200 weeks over 20 years. So that's a significant number of weeks that these regions were subjected to drought. Next slide, please. Fire weather season has also gotten longer. And this is not just a US problem, it's a global problem. So when you look at that diagram, you can see that the fire weather season in some regions has lengthened by more than 40 days. And this is fairly up-to-date information from 1979 to 2019. We're concerned about wildfires because it impacts human health and well-being, as well as the natural environment. And human-induced warming has led to a global increase in the frequency and the severity of fire weather and increases the risk of wildfire. I should point out here that land management, which is on humans, can enhance or compound climate-driven changes in wildfire risk. And I left that line in there because this is an avenue that we can actually work on to mitigate the risk of fire. Next slide, please. Still on fire. Fire weather has become more frequent and intense, particularly in the Western US forests. So the map on the left shows you what the fire distribution looked like for the Western US just a week or two ago. And you can see that Oregon and California are pretty much under siege. On the right, it just tells you how many wildfire acres burned in the US by year. What you can see right away is that there's some variation from year to year, but generally, as you move from 1983 to 2017, the number of acres has increased. And this year, which is not shown on that graph, this year it's well above the numbers that you see now. We have record levels burnt. Next slide, please. Flooding. Flooding is becoming a problem and is exacerbated by climate change. Because we have warmer conditions, we have more intense hurricanes. Not necessarily more frequent hurricanes, but when they come, they're more intense. And they bring more precipitation and cause more frequent flooding. This is Hurricane Sally in Florida, and that's just a little while ago. I use this one because it might still be in people's memory. And you can see immediately its impact, and you can go to the internet and find a whole bunch of others like that. The next one, next slide, please. This is flooding, but it's not associated with the hurricanes that come off the ocean, but this is flooding associated with more frequent and more intense storms that we're experiencing on land. When you couple something like these more intense storms with rapid early snow melt, because it's warmer, it leads to more frequent flooding. So last year, this picture is taken last year in the Midwest in March, where there was historic flooding because of that sequence: more intense storm, rapid early snow melt. Next slide, please. So we're probably not concerned, we're probably most concerned rather about food, shelter, health, the economy, and the environment. And the question that I would ask is, how would climate change affect those concerns? Putting everything I just said together, and I haven't even talked about everything that the climate change influences. We can see that rising temperatures, extreme heat, drought, wildfire, and floods, sea level rise, they affect a range of things that are important for us. They affect the air quality. They affect human health. They destroy homes and property. They degrade the infrastructure, disrupting agricultural productivity, livestock health, and they also affect crop yields and quality. The list could be longer. The fact is, there's a quote that I took directly from the National Climate Assessment in 2016, and left unchecked, climate change will continue to degrade infrastructure performance over the rest of the century, with the potential for cascading impacts that threaten our economy, national security, essential services, and health and well-being. Next slide, please. The good news is that we don't have to actually sit and watch it all fall apart. There are things that can be done. We can work to mitigate the negative effect of the changes in the long term, because these changes are going to continue. We can reduce greenhouse gas emissions. We can develop technological innovation in mitigation and methods to remove carbon dioxide from the atmosphere. We can take steps to protect vulnerable communities and to build resilience by putting pre-disaster mitigation measures in place. We can adapt to the changes that are taking place now. And for me, at the personal level, I include this. We can reduce, we can reuse, we can recycle. And I know we focus a lot on recycle, but reducing actually reduces the need for reduce and need for recycling as well. That's my little sermon. The point, a major point, is action on all of these fronts will help to avoid substantial damages to the economy, the environment, and human health over the coming decades. And I'll stop there.
Thank you, Marilyn. I think that was a really lovely and comprehensive introduction to climate change and its impact on our society. Do you have a question that you would ask a candidate? You want to wait?
Yeah, let me wait a little. I have one forming, but it's going to take some time.
Great. So we're going to move next to Dr. Fatima Shafai, who's an associate professor, chair of political science, and director of the environmental science program at Spelman College. which is one of our nation's historically Black colleges and universities. And she works there to help educators and citizens learn about and teach sustainability and environmental justice. So she's going to build on what we've learned from Marilyn and give us some thoughts about the intersection of climate change, environmental justice, and sustainability.
Indeed, we hear so much about you're muted these days. So thank you for the invitation, and I'm honored to be here among these distinguished scholars, activists, and so my take on this issue of climate change is that Professor Raphael so eloquently, thank you for your comprehensive presentation. You eloquently stated and warned us about the perils of the climate change and its serious consequences for all of us, with the heat wave, with the rising sea level, with the unpredictable floods and everything. And I know that this warning has come from many corners, from UN Secretary General calling it climate change the defining human development challenge of the 20th century, and 21st century. And again, we keep hearing it from different sources that it's going to impact us all. But what I'm going to bring to this conversation, that indeed it is going to, climate change is not going to spare any country, whether they are rich or poor. None of them are going to be immune to the adverse impact of the climate change. However, the risk associated with the climate change is not, the risks are not uniform. And the threats of climate change do not really operate in a silo independent of other vulnerability. And as such, poorest countries are most vulnerable to the catastrophic impact of global climate change, and low income and communities of color are also disproportionately impacted by the climate change. And the entrenched inequity of climate change is that it is the poster child of the displaced hardship, because the worst effect of global warming are likely to fall on the shoulders of the very people who were least responsible for contributing to the problem. And the disparity in terms of the effect of climate shocks and vulnerability, it is a phenomena that Desmond Tutu called adaptation apartheid. And that really captures the issue that we in environmental justice frame the climate change around that issue. Because again, when you look at it, and also when you see the communities are facing this formidable challenge of the environmental racism and economic injustices that they are dealing with daily. We know that neither climate change nor virus, they don't know anything about race, they don't know about anything about ethnicity, but then we see that the pandemic happens, as so eloquently was stated in the previous panel about the disproportionate impact of the COVID-19. And I think what climate change, COVID-19 puts in place is that centuries of willfully blind policies and practices have subjected Black, Brown, Indigenous, and low-income communities to these disparities in health, in wealth, in every aspect of quality of life that made them vulnerable
And we see that from cradle to grave. And I think that even the new studies are showing that in their womb these people are subjected to the harmful exposure to pollution that really shape the rest of their lives a lot of time. And what we see is really climate change is not just an environmental issue, it's a human rights issue. It's a socio-economic equity issue. And it really intersects with race, class, gender, and place. And it brings, like the pandemic, it's the convergence of all these vulnerabilities or baseline that really create the crisis that these Black, Brown, Indigenous, and vulnerable people are facing. What we need to do if we want to think about solution is to really stitch these pieces together. I know that everybody talks about connecting the dots, but I like the way I want to stitch it. Because if you stitch them, they stay together rather than, connecting and then erasing that. And we really need to look at this forest, not just one tree. Look at climate change. We talk about social distancing. We talk about shelter in place. If you're in Cancer Alley in Louisiana, how are you going to social distance when Hurricane Laura comes? Now, Hurricane Delta is coming. So, and then if you talk, Professor Raphael talked about the heat wave, redlining. There was a study that just was published in January that showed redlining really impacted, the history of redlining in this country have impacted the temperature. If you look at the history of redlining and the temperature in 108 cities that the study did, they concluded that the temperature was at least 2 point higher. If you look at now toxic waste in the United States, June started the hurricane season. And then with that, we are seeing, Laura, Delta, and they are coming. And what happens if you live in an area where you are not just dealing with the hurricane that is caused by climate change, but you're living in a hazardous area that you have to deal with the chemical spill, toxic flooding. These are the realities. We saw how Laura, impacted Lake Charles in Louisiana. There are communities, Mossville, Covenant, all of these communities are dealing with climate change. So we really need to think about what we are going to do with the climate change. And we need to put it in the context and prism of the environmental justice. We need a just transition. We need to look at these inequities. We see that, again, if you look at the convergence of Black Lives Matter, I know a lot of people talk about George Floyd's and he can't breathe, but we in EJ community knew asthma stopped people from breathing. We know that Freddie Gray, before he had that encounter with the police violence, he was the victim of lead poisoning that shaped his life, that led him to life of antisocial behavior that is clearly scientifically associated with being exposed to lead. We know that Harvard says that PM 2.5 increases the mortality from COVID. We know that people of color are living next to coal power plant as early as 2002. Our own Felicia Davis Cole authored a study that was called Air of Injustice. So we have the data. We have the enough to tell us that things are wrong. The state of affairs is not sustainable. We need to really go back. I don't want us to go to post-COVID normal. Normal led us to what COVID did to us. Normal is gonna do us what the climate is doing now. I want us to rechart, reimagine the post-COVID, where we will really address these vulnerability. There are beautiful legislation that has been introduced, environmental justice for all. House, I would commend you. For the first time, there was an ad hoc committee that released on June 30th, the climate report. And I was so pleasantly surprised when I saw 12 pages of that 300. I know it's not much, was devoted to EJ. And then I see that for the first time, presidential election talks about climate change in a serious way. And Biden has a clear climate platform and has also environmental justice component. So I can go on and on. So I'm going to stop because I know that I have already taken too much time.
Thank you, Dr. Shafee. I think our next respondent is Jacqueline Patterson. Jacqueline is, whoops, I lost my notes. Jacqueline is the director of the NAACP Environmental and Climate Justice Program. She's a policy analyst, researcher, program manager, coordinator, advocate, and activist working to create environmental and climate justice. So Jackie, can you give us a few thoughts and then perhaps a question for candidates? And I'm gonna set a timer so that we don't run out of time here.
Yeah, that'll be great. So 5 minutes, or do you want me to try to do less?
I think if you could do 4, that'd be awesome.
Set my stopwatch then. Yeah, so basically I'll just continue on with what others have said. One thing that I have been thinking about and talking about is what ties together the racial awakening, COVID-19, and climate besides in the context of the systemic underpinnings that others have spoken about, is this whole notion of sacrifice zones and sacrificed people, and really the devaluing of certain lives and therefore the extent to which science is trusted or science is heeded, not to mention, and in the context of that, and the way science is actually used in some ways to justify devaluing certain lives and people. So whether we're talking about the comment that I was looking for just before I got on, that the administration made at one point about how basically most people get the COVID-19 is survivable for most people except for certain populations, as if that's kind of reason enough to just dismiss it because it's only certain populations for whom this is a fatal disease. And similarly with climate change, whether it's the communities in which the same coal-fired power plants or oil refineries or incinerators or landfills or confined animal feeding operations are located, are the communities that are considered to be sacrifice zones because their lives matter less. And even in the context of COVID-19, this notion of essential workers, but it's really the work that's essential, and the workers are considered to be disposable, not necessarily kind of as an explicitly stated thing, but by action or inaction in terms of providing the proper protections and the proper provisions, whether it's sick leave, paid sick leave, or otherwise. And similarly with our communities, instead of actually pushing forward on environmental protections that are needed to save the planet and save people, we're rolling back environmental protections in order to preserve profits and to concentrate wealth. And though all of those kind of differential valuing of people is at the root of where we are as it relates to kind of this unfettered plunge towards catastrophic climate change that we're already seeing all day, every day. And so for us, this is at the root of why we can't just tweak such a deeply flawed system, that we really need total systems change, and why it is, going back to this civic engagement theme, that we need to be really thinking about making sure that who's in office is actually representing our interests, and that we're not just thinking about kind of reform, kind of a mild reform agenda as it relates to policy, but an actual revolution agenda, so that we have policies that shift us from systems of exploitation and domination and extraction to systems of regeneration and cooperation and actual democracy. So for me, a question that I would ask as I come to the end of my 4 minutes plus is whether the politicians coming into office would actually support campaign finance reform, so that we actually have a true democracy, as opposed to fossil fuel companies and other large money interests controlling so much of who ends up in office and what policies get passed or don't get passed. So thank you.
Beautifully done. Beautifully done, and a strong question that to end on. Our final panelist is Dr. Robin Bell. She's a geophysicist and a senior research professor at the Lamont Doherty Earth Observatory at Columbia University. Her work, she creates instruments to look into ice sheets in Antarctica and Greenland that allow us all to understand the response of those ice sheets to climate change and its implications for sea level rise and our globe. Robin is also the president of the American Geophysical Union. And Robin, I'm going to give you the floor and let you go with a response, a question, and a concluding remark, with switching hats in the middle from being a scientist to being the AGU president. And then we can give it back to Holly for the final word.
Alrighty. First, I want to thank everybody, and what a marvelous, I've learned so much. Thank you, everybody. And you might wonder how it is a scientist who, my job is, to walk around and fly over ice, and it seems so removed from communities. But the more I've done my work, and the more I've realized that these massive pieces of ice, that when I started to work in the polar regions we didn't imagine could change, that they're changing, and that they're impacting our communities. And I started just by thinking about how much sea level has gone up since my grandmother was born, and since we don't have any video, I think everybody can do it. You can just put your hand on your leg and think about 9 or 11 inches is, depending on where you are, and that's how much the sea level's gone up around the world and around the US since our grandmothers were born in the last 100 years. And increasingly, I've begun to realize that I have to think about how to connect the science we do with our communities, and particularly those most vulnerable communities that we've been hearing about, because they're the ones who are really at the front line of climate change. And I think it's very incumbent on scientists to figure out how to do this work. And it's hard because that's not what we're trained in. When you study public health, you are, but not when you study climate. When you study climate, you're trained in equations mostly, and patterns, and less so in working with communities. So I think it's one of the challenges, and one of the things I would ask a candidate is, how are we going to ensure that we inject the knowledge of how our planet works responsibly at all levels of government and all levels of dealing with communities, is that all communities deserve to have that knowledge, and all communities should be having that knowledge to move forward. That's where I, similarly to both what Jacqueline and Fatima have said, is I see the connections between climate and COVID. That science is going to drive science is so essential, but the same people are so vulnerable. And there's so many lessons that we're learning from COVID that are so applicable to the climate response. So that's my, where I come as a scientist at this problem, and how I'm so keen to see the work that say Marilyn does, and figure out how to connect it with the communities, and how to have the communities ask the questions about what they need for their futures moving forward, and not just have the scientists come in and say, this is what we know here, dudes, but actually work collaboratively with the communities. And that's the vision I have looking forward. So that's me as a scientist. But now I'm going to change my hat to sort of my larger role as president of the American Geophysical Union, which is the largest collection of Earth and space scientists. We bring together about 300,000 scientists who worry about the planet every year. And when we sat down to look forward, we really wanted to figure out how we could move past this concept that discovery is what drives our scientists, but to link discovery and solutions-based science, so we can bring science to the table in a more broad manner, so that we can together look at a sustainable, equitable, thriving future for everyone based on science, innovation, and action. And that's really different for a scientific community. Scientists mostly like to sit in their labs and look at their numbers and their data. But we really believe that science must underpin what we do moving forward. We've seen it through COVID, and we know it's the case through climate, that we as individuals have to take action. Marilyn reflected that we as individuals must see what we can do to address the climate change and to address COVID. We must look to see what our institutions can do to help. And that's why it's so important to ask the questions of our candidates. What are you going to do to ensure that you consider climate in all your decisions, because it is essential for the future of our species on this planet. And then finally, we must make it cultural, that we, just as we have come to culturally accept that masks are appropriate, we have to culturally accept that addressing climate is not a political issue, but is just an issue that's fundamental for the future of our species on the planet. So today, I think we've heard so much on both challenges we as a species are facing. We're really global, we're really interconnected, and there's so many lessons to learn here. And I love the concept of stitching these together, not connecting the dots. I see this as weaving the knowledge of how science can, if used right, inform a better future for us all. So with that, I want to thank Holly and Felicia and Kathy so much for putting this together. And I'll turn it back over to Holly. And thank you, everybody, I learned so much today, and I appreciate the time, the energy you've put into this.
I just want to thank you, ladies. This has just been awesome. And I think, one of the things that we wanted to do was to make the case as to why science is on the ballot. And if between these two panels, if the case has not been made, then I don't know what else can be said. And as an attorney, I can say, not only did we make the opening argument, not only did we present all the evidence in true fashion, but also the closing arguments have been made and the case should be rested. And that is that we need to make sure that when we're thinking about our vote and we're thinking about being engaged, that we understand that science is in fact on the ballot and we should vote as if our lives depend on it. I want to say a special thank you to all of our guests and panelists. I want to say a thank you to all of you who have stuck in there with us. We kept our audience throughout, and I appreciate you all so much. These are the kinds of things that we try to do as Sisters Lead, Sisters Vote, by having provocative conversation. And I cannot leave or finish out without acknowledging that this could not have been done. This was truly the brainchild of Felicia and Kathy. I am honored to have been a part of this because of you. I want to thank Robin for all that she did to make this happen. And I wouldn't want to leave this space without thanking my team, Holly Weeks, as well as our lead man. Thank you and good night.
Holly, just before we close, just another special shout out, even to our Congresswoman who opened us up and who.
Oh my goodness! Thank you for cleaning that up for me.
Way.
Absolutely, and thank her for all the work that she does as chairwoman of the Science Technology Committee in the House. Because of her leadership, it allows us to be able to do what we do. Thank you. And this time, good night.